It's a good question, frequently asked that by parents, so it sounds counterintuitive. So stimulants, when used in a manner that are not supposed to be used in, can create euphoria. The medications used to treat ADHD can be abused by some people. They tend not to be used in the doses that we would be using, or they tend not to be used in ways that we would recommend. So frequently, rather than taken orally, they're injected or snorted or those sorts of things. And in those situations, you get euphoria and increased blood pressure and pulse and all those sorts of things. At therapeutic doses, you tend not to get increased feelings of well-being or euphoria, but you can get some small increases in pulse and blood pressure and those sorts of things which need to be monitored. Some people say that stimulants, it's to do with them stimulating the noradrenaline and dopamine neurotransmitters, and other people suggest that stimulants stimulate the frontal lobe and its connections with other parts of the brain which are understimulated in people with ADHD. So frequently parents are concerned about change in personality in their young person, and that's a concern for us as well. And for the most part, the underlying personality structure of a young person won't change. If people use stimulants in very high doses, you can get over-focusing and a kind of zombie effect, but it's dose-related and would indicate that the dose is way too high, and we would be looking at reducing the dose or trying out an alternative medication. That's a completely reversible effect, so when the medication's out of your system, we'd expect your personality to go back to your usual self reasonably quickly following that. You can get some subtle changes in personality, so people can be less reactive, which we would think is a good thing. They can be less impulsive, can be less reactively aggressive. So there can be some beneficial personality changes, but if people have concerns about that, then on stopping the medication, people would go back to their normal self fairly quickly. So people with ADHD, as they grow up, are more likely to engage in substance misuse. So they're known to have a higher likelihood of that. And many parents are concerned that giving a medication that can be abused increases the likelihood of that. There have been 13 or so trials looking at that. There was a big review of that in 2013, and it suggested that there was no negative effect of early use of medication increasing substance uses in later life, possibly having a slightly protective effect. So we don't think that's a strong factor.